Be inspired, supported, and empowered. This is the Global Healthy Living Foundation podcast network.
Hi, this is jcoe, host of Talking Head Pain, the podcast that confronts head pain head-on. I'm here in Denver attending the American Headache Society's annual science meeting. I got to catch up with Dr. Rob Cowan to learn from him what he's hearing about migraine and how it impacts our patient community.
So my name is Rob Cowan, and I'm a neurologist at Stanford, doing exclusively headache medicine and headache research.
That's amazing. And we're here in Denver at the American Headache Society. What are you finding most insightful or interesting?
Well, today's still the first day, so we'll have to see. But I'm seeing some very hopeful trends, hopeful for patients. In particular, I think we're starting to see that the notion of episodic versus chronic migraine is not a black and white situation. You know, it's not like being pregnant. You either have episodic and then suddenly you go from 15 days to 16 days and now you have chronic migraine. We're starting to understand that it's a process, and we're starting to look more carefully at the slope of that curve if you're increasing your headache frequency. One of the big changes we've seen recently is we now have medications that have an indication for both chronic and episodic migraine, which I think is smart. Most of us are much more worried, and patients are much more worried if they've gone from 4 headache days a month to 9 headache days a month than if they've gone from 14 headache days a month to 16 headache days a month. So I think that's a very positive trend. We're also seeing increasing attention to the hoops that we all have to jump through to get new medicines. Traditionally, we've had to try older, more familiar medicines which have a weaker evidence base and more side effects than newer medicines. And that's largely because of the economics. Insurance companies don't want to pay for expensive medicines if they can get away with cheaper medicines.
So you're talking about prior authorization and step therapy.
Yeah, exactly. There's a very interesting poster at this meeting by Meredith Barad from our group. And what they did is they actually looked at the evidence base for the tried and true, the propranolol and nortriptyline medications, and compared that evidence base, looking both at efficacy and side effect profiles, with the newer and obviously more expensive medications that require a prior authorization and a stepped trial of these older, more familiar medicines. And what did
they find?
What they found, and you should talk to Dr. Barad about this because it's her work. But what they found basically is that the evidence for the older medicines is much weaker. The side effects are much worse, and probably, and they didn't go this far, but I can because it's not my study. Probably, it turns out in the long run that not only is it worse for patients, but it ends up costing more. You spend more time with comorbid illnesses, you spend more time in the emergency room, more time visits, more experimentation with medications, rather than going to the best medication first.
Amazing. Well, thank you so much for your insights. I'm sure our community will appreciate them.
Absolutely.
If you live in the U.S. and you want to stay in touch with Talking Head Pain, text the word headache to 1-845-285-1563. That's headache to 1-845-285-1563. And you'll receive headache and migraine-related resources, giveaways, and the latest Talking Head Pain episode releases.
Be inspired, supported, and empowered. This is the Global Healthy Living Foundation podcast network.